Hey you guys, welcome back to another Miseducated Rambler video. My name is Bulani Dube, but YouTube prefers to call me Miseducated Rambler. So welcome. So today we are going to be talking about a topic that is rarely talked about. It affects women, and it's highly likely that either you or someone you know has fibroids. Yeah, so I just said it. That's the topic we're going to be talking about. We're talking about fibroids. Fibroids are so common, and I feel like it's important to talk about them because people don't know what they are, what causes them. Um, there are scares where people feel like, is this a cancer? So we're going to be answering all those questions in this video. Please stay tuned. So specifically, we are referring to uterine fibroids, which are medically termed leiomyomas. These are hormone-dependent growths that are made up of connective tissue and smooth muscle that grow inside the uterus. Okay, fibroids can get as big as 1 millimeter in size, right? 1 millimeter to 20 centimeters in diameter. We're talking diameter here, right? 20 centimeters or even larger than that. So, just to give you an idea, imagine a seed, maybe a mustard seed. Because, well, they can be like really tiny where even the naked eye cannot see them. Um, so, very tiny, and then they can grow as big as a watermelon. So there is actually no known cause for fibroids, but they are linked to genetics, um, stem cell changes, as well as hormonal factors, right? So hormonal imbalances and stuff like that. So if you're wondering who gets fibroids, fibroids can affect anyone that is female with a uterus and in the reproductive age. So if you're able to get pregnant, right? If you're in the ages where you are capable of getting pregnant. That's obviously because of the hormones that are involved, right? Estrogen, progesterone, those are hormones that peak, especially when you start having your menses and all of that. So, yeah. Let's get into factors that would increase your chances of developing fibroids. Okay, so the first one is genetics, where if you know that your mom has fibroids or your sister has fibroids, your aunt, maybe your grandma, your great grandma, any blood relative of yours that has ever had fibroids or has them would tell you that you are highly likely you are a candidate of also developing fibroids. Okay. And then the other factor is vitamin D deficiency, which I would put it back to back, hand in hand with race. Um, so, Black women are at a higher risk of getting fibroids and getting fibroids that will multiply and grow to big sizes because of the vitamin D deficiency thing. So, with darker skin, melanated skin, what happens is it doesn't absorb sunlight as much as white skin would. Okay. So, vitamin D is important because it slows down the growth of fibroids. So, if you're not absorbing enough vitamin D from the sun, then that would mean that nothing is slowing down the growth of the fibroids. Okay, so that's vitamin D deficiency. And then the other factor is chemical exposure. Black women tend to use hair products, beauty products that have hormone altering chemicals. Okay, so there's been studies that have shown, I think you might have come across them in the news or wherever, where they're saying that these chemicals are absorbed into your skin, into your body, and then they will cause hormones to be released in high quantities, right? And then like with the estrogen and the progesterone, which we said they directly affect the growth of fibroids, right? So these chemicals can increase the release of these hormones, and then fibroids end up growing. So it's common with Black women because we use all this straightening, these chemicals that help straighten our hair, the relaxers, and the likes. So you need to be careful what you are putting in your skin, in your hair, and all of that. I'll put the link for the article where you can see and read more about these products, right? So the products include lead, and it's a lot. So I'll put the link in the description box. Another factor is stress. Okay, so what happens is when you are stressed, the brain will tell your body to release hormones, the cortisols and all of that. When cortisol is released, it will also cause the release of estrogen and progesterone. So when you are stressed out, these hormones are released in high numbers, and then fibroids grow. Okay. And then there are other factors like starting your period. If you started your period before the age of 10, okay, obesity is a factor as well. Having a diet that is rich in red meat, where you eat a lot of red meat, but you don't eat a lot of greens or fruits or dairy, right? Like your cheese, your milk, and all of that. And also drinking alcohol can be a factor. So let's talk about the types of fibroids that are out there. We have intramural fibroids, which are fibroids that develop within the muscular wall of the uterine. Okay, so they start off as tiny, like they'll be very, very tiny, but as they grow, they extend. They would either extend inward towards the uterine or extend outwards towards the pelvic cavity. Okay, and these are the most common types of fibroids. Okay, these constitute or account for up to 70% of all the diagnoses for fibroids in the world. Okay, and then the second type of fibroids that we have is the subserosal fibroids. The subserosal fibroids develop in the outer wall of the uterine. Okay, so they would extend towards the pelvic cavity, and they account for 20% of all fibroid cases. Okay, and then the third type is submucosal. Submucosal. Okay, please don't judge the way I pronounce some words. I know that people out there that are experts. So the third one is submucosal. Okay, this one would develop just under the lining of the uterine, so where the embryo would attach itself and develop, right? So we term that the endometrium. Okay, so that fibroid would extend towards the uterine. And then lastly, we have pendiculated fibroids, which involve a stalk. Okay, so they have a stalk, which is the muscle that the fibroid would be hanging from. So it would either hang inside the uterine or outside the uterine. And then just to answer a question that people tend to have of whether fibroids are cancerous or not. Fibroids are not cancerous. They are not precancerous. They cannot develop into a cancer either. Okay? So yeah, fibroids are benign tumors. They are not malignant. Malignant would mean cancerous, right? Yeah. Alrighty, that is it for this video. If you found it helpful, please let me know in the comment section, or leave a like. Please subscribe to my channel and look out for the next video, the next couple of videos where I'll still be talking about fibroids, because it's really a big, broad topic subject that we need to normalize educating ourselves on these kind of topics, to be honest. So look out for that video, and thank you so much for watching this video. See you again in the next one. Bye.